Now, May is American Stroke Awareness Month. Now, this is according to the American Heart Association. Stroke is the fifth leading cause of death, and a leading cause of adult disability in the United States. On average, someone in the U.S. suffers a stroke every 40 seconds. Nearly 795,000 people in the U.S. suffer a new or recurrent stroke each year. Joining us now to talk more about it is a doctor, Dr. Hormozd Bozorgchami. Oh, geez, Doc, I'm ruining your name. Let me try it, though. Just bear with me. Hormozd Bozorgchami. How did I do, Doc?
You did wonderfully. Thank you for having me.
All right, well, forgive me. I'm just going to call you Doc the rest of the way. Look, you're a leader in this department. You work with St. Luke's Health and the Woodlands Hospital. We appreciate your time. This is a very important week, or a very important month, I should say. Can you talk a little more about the numbers and maybe what's leading to them?
Sure. We still have a lot of work to do in this country for stroke prevention. One thing that we have done well is that stroke used to be a third leading cause of death. And, we brought it down to the fifth leading cause of death, mainly because in the last 5 to 10 years, we've had some advanced stroke treatments that we can do on an emergent basis. Clot retrieval in the acute setting has really changed the way we treat stroke. And our EMS partners have worked really well in mobilizing stroke teams early, and we have this excellent system of care that, in the Houston area, where we can do rapid assessments of stroke patients and get them treated quickly. But we do still have a lot of work to do in the stroke prevention realm. There's about $50 billion in cost for just stroke care, and because it is the leading cause of adult disability.
What are some of the signs, Doc, for folks to look out for with regard to a stroke?
Just about if any part of the brain is affected, you can have all sorts of symptoms. But the main ones we try to get out in the public is this mnemonic called FAST. And so we look for facial weakness, arm weakness, speech changes, and then the T is for time, meaning call 911, get to the hospital as fast as possible. But any sudden, often weakness on one side of the body, that is very concerning for a stroke.
These symptoms could be, I guess, confused with others. I mean, how would somebody know the difference? Is that difficult to know?
Sometimes it can be difficult, and there are a lot of things that can mimic a stroke. But since stroke is the most dangerous thing, and it's the most time-sensitive thing, we just want people to just assume the worst, get 911, get care. But we often want to look for any sudden changes. Strokes don't happen gradually over time, very rarely.
Interesting. Okay, so it's something where the onset happens very quickly, sort of out of the blue, I guess.
Yes.
Okay. So you've talked about the treatment and some of the great strides that the medical community's made there. Prevention, as you said, it needs a little more work. What kinds of steps can people do, not just long before even noticing the symptoms? Can we take better care of our health? Is it more sleep? I mean, what kinds of things can we do to avoid a stroke even to begin with?
Well, I'd say the biggest thing that is missed is hypertension in this country. Because it sneaks up on you as we get older and it doesn't have symptoms, people are often undiagnosed with high blood pressure. So it's really important for people to periodically check their blood pressure. That is the #1 untreated stroke risk factor. It certainly can lead to a lot of other problems. So when you're at the drugstore or something and you see that machine that you used to probably play with as a kid, you want to go and just get it checked. Or if you have a machine at home, they have a lot of different kinds of automated blood pressure machines, and you can just periodically check and make sure that number is around, the ideal is 120/80. And if it's starting to get above 140 on that top number, then you really need to seek a primary care physician to kind of help get you on some medications to control your blood pressure.
Thank you, Doc.
Other things, it would be diet and exercise, as we all are always guilty of. Just some light exercise daily can reduce the risk for stroke.
Doc, thanks so much for spending the time with us. Dr. Bozorgchami with St. Luke's Health, the Woodlands Hospital. Really appreciate your time, sir.
Thank you for having me.
Okay.